We are so grateful to the Winnipeg Foundation for the $950,000 grant that is going to allow us to support 3 major initiatives here at St.Amant. The St.Amant Research Center will support the planning and evaluation of 3 transformative projects here at St.Amant. The first is the transition of 75 people from River Road to the community. The second is the creation of a continuum of respite services. And the last will allow us to evaluate the creation of our new crisis stabilization services.
The research literature and the professional literature dealing with developmental disabilities can't tell us all that much about the best way to do these things. You know, we'll be looking at how the changes affect, first of all, outcomes for St.Amant's clients, for the families that we serve, but also for the organization. What does it mean for the individuals? What does it mean for their families? What does it mean for the service professionals who are maybe having to learn how to deliver service in a new way or in a new context? What we learn has the potential to be really transformative. It could inform policy, for example, around the funding and provision of services to individuals in Manitoba for years to come. So it's a great opportunity.
It's been really important to have a respite program at St.Amant because it allows families to have periods of rest, and it usually benefits especially the families that have the more medically complex individuals. And I think ultimately it has saved many of the family dynamics of many clients we serve.
We learned through our worker, she told us about it, and St.Amant is a name that's familiar to most people in the city.
I think that the importance of providing respite for people just to be able to recharge their batteries and continue on with the responsibilities is I think it's difficult to place a value on that.
Crisis stabilization is a community-based service that we hope to partner with over 50 agencies on. I believe that St.Amant is in the best position to provide crisis stabilization services for those in Winnipeg and beyond, based on 2 reasons. The first is expertise. We have a long history of working with clients with challenging behaviors and a really great success record. The second reason that we're suited to provide this service is based on our resources. We have a variety of clinical resources that range from physiotherapy, occupational therapy, and to significant and intensive psychology services that help us best provide service to those that are struggling with behavioral challenges.
The second initiative will improve access to healthcare for people with developmental disabilities by creating a community clinic. And in addition, in partnership with the University of Manitoba, we'll be able to train new doctors coming to work in the community, as well as enhancing the educational opportunities for physicians who are already part of the community.
The healthcare system wasn't really set up to manage people with intellectual disabilities, people that are nonverbal, and be able to assess them properly. It does take some skills to do that, and those are teachable skills. I think overall we know that as people are in the community that there are certain types of health problems that often are challenging. Even just simply as going to a family doctor or a walk-in clinic office, but having to wait in a busy office for an hour to spend 5 minutes with a physician and probably require more time than that. These are all things that a different type of model where we can go out to the community or provide more outreach and support is going to make us a stronger healthcare community, but also really benefit the disabilities community.
I think in the long term what this does is it helps train physicians that have the tools and the skill and the knowledge to care for these patients in their practices. And when we look at how we better support patients within the community, we need to ensure that all our providers have that skill set. I think what we will get through this initiative are the tools that ensure that patients really get comprehensive preventative care that's tailored to their specific needs. This is a really innovative project. It helps us as a university interact with our community partners and ultimately make a difference in the care we provide patients.
We're changing healthcare for people with disabilities in a way that's going to be not measured in a year or 2 years, but it's going to be measured in a decade or 2 decades. These are the changes that need to happen in healthcare, and we're making it happen at St.Amant. So this is exciting to be part of it.
Our third project is to renovate one of our living units here at River Road to bring it more up to the standard of other healthcare facilities and long-term care facilities.
The benefits of having a single room is you get much less spread of infectious diseases. You get much less spread of simple colds. So just a healthier population, and with a healthier population, they can have more active lifestyle. Much nicer to be able to have care provided to you in a private setting versus in a shared setting.
And for us, it allows us some quiet time where you're not being interrupted. You're not intruding on people, and they're not intruding on you while you're visiting. And Angela has a room to herself, which is now about twice the size of the old room she had. So she's got all the room for all of her equipment. It's private. We can bring in all the pictures we want, the wall hangings we want, drapes for her windows, that type of thing. So it was quite a move. So with that, I'm just saying that it would be a real blessing to see everybody in that situation.
The work that we're going to be involved in will create a fundamental shift in how services will be delivered in the future. Historically, much of our expertise has existed in an institutional model, and what we're hoping to do through this initiative is share that expertise and to strengthen the continuum of services that are available within the community. We are extremely grateful to the Winnipeg Foundation for seeing the value of people with developmental disabilities and for giving us this grant to accomplish what we see as absolutely mission critical work for our organization and the larger community. So thank you very much to the Winnipeg Foundation.